Welcome to the Deep Dive. Today we're plunging into a topic that might seem highly specific, but holds surprising depth, urgency, and some really intricate challenges. Equine corneal and scleral lacerations.
They really are serious eye injuries in horses, yeah. And the source material we've looked at, it really lays out the critical nuances of, understanding them, diagnosing them, and treating them effectively.
So our mission today is to distill the most important nuggets of knowledge from these sources.
Mm-hmm.
We want to give you a comprehensive understanding of what these injuries actually entail, why they're so critical, and the frankly incredible measures taken to try and save a horse's vision. You might be surprised by how common some of the causes are and the sheer intricacy of the medical details involved in fixing them. Understanding the injury. The basics of equine corneal and scleral lacerations. Okay, let's unpack this a bit. We're talking about trauma to either the transparent front part of the eye, that's the cornea,
Right.
or the tough white outer layer, the sclera. What makes these particular eye injuries so significant, so urgent for a horse?
Well, what's truly critical here is that ocular trauma can affect any eye structure, really, and the consequences, they can be devastating for vision. Our sources highlight a really crucial distinction. Blunt injuries generally carry a worse prognosis than sharp, penetrating ones.
Oh, interesting.
Yeah, and this is vital because blunt forces tend to sort of reverberate throughout the entire eye. They cause widespread, often hidden damage, while sharp forces are usually more localized right at the point of impact.
So if a horse gets a direct, sharp puncture from something, it might actually have a better outlook than if it's hit by, say, a forceful blunt object like a kick, even if the blunt impact looks less gruesome initially.
That's often the case, yeah. It's counterintuitive, but really important for owners to grasp.
Right. And these injuries can happen to any horse, I assume, any age, any breed.
Pretty much, yeah. No horse is immune.
But what are the first things you, as an owner or maybe just an observer, might notice? What are the key signs that tell you something is seriously wrong?
Well, the horse's eye will typically appear cloudy, definitely red, and show clear signs of pain.
Okay.
You'll very often see blepharospasm. That's that constant eyelid spasm, the squinting.
Right, the tight squinting.
Exactly. And excessive tearing or lacrimation, along with focal or generalized corneal edema. That's the swelling and haziness of the cornea itself. But there's a subtle sign, one our sources mentioned, that's incredibly important, often overlooked. A slight ventral deviation of the eyelashes of the upper eyelid. Kind of a droop.
Wow, okay. That subtle eyelash sign sounds like a crucial early warning. But what happens when the injury is clearly more severe? When the horse is in obvious distress and the eye is visibly compromised.
Right. So if it's a full thickness perforation, meaning the injury has gone all the way through the eye's layers. Yeah, you'll often see iris prolapse. That's where the colored part of the eye, the iris, is actually pushing out of the wound. The anterior chamber, that fluid-filled space at the very front, it'll appear shallow or sometimes even collapsed. And there's often hyphema, that's blood in that front chamber.
Okay.
And if the lesion extends to the limbus, that junction where the cornea meets the white sclera, it's absolutely crucial to check the sclera extremely carefully. Scleral wounds can be surprisingly obscured by conjunctival chemosis,
Which is
significant jelly-like swelling of the pink membrane covering the eye, and of course, obvious hemorrhage. So the true extent of the wound can be hidden by the body's own immediate reaction.
Considering how delicate and exposed a horse's eyes are, you have to wonder, how do these devastating injuries typically happen? What are the common culprits the sources point to?
It's actually startling. The culprits are often found in what seems like a horse's safe, everyday environment.
Really?
Yeah. Our sources list things like loose nails in a stall wall, sharp edges on feed buckets, or even light fixtures, vegetative material like corn stalks or low-hanging tree branches in a pasture they know well. It really drives home the fact that just constant awareness of your horse's immediate surroundings is maybe the simplest but most crucial preventative measure. 2, pinpointing the problem. Diagnosis.
Okay, so given how painful these injuries clearly are and how potentially severe, how do veterinarians even get a clear picture? I imagine it's incredibly challenging to examine a horse in that much pain and distress.
Challenging is an understatement. It really is. Our sources emphasize that sedation and often regional nerve blocks are frequently necessary.
Nerve blocks, like?
Like the auriculopalpebral block. It temporarily paralyzes the eyelid, stops the blinking and squinting.
Oh, okay.
And that allows for a thorough and, importantly, safe ophthalmic examination without the horse flinching, which could actually worsen the injury or just prevent the vet from seeing everything.
That makes sense. So once a vet has managed to get that clear look, what are the crucial diagnostic tools and steps? How do they pinpoint the exact nature and extent of the damage?
Fluorescein dye staining of the cornea is paramount. It's almost like detective work for invisible clues.
How does that work?
Well, dye, when you put it on the eye, it stains any area where the outer layer of the cornea is broken or scraped. It clearly reveals the laceration.
Right.
And if it's a full-thickness perforation, the dye might even be seen entering the anterior chamber. Then there's the Seidel's test using that same fluorescein dye. It's quite a remarkable visual trick.
Oh.
It can reveal actual leakage of aqueous humor, that's the fluid from inside the front of the eye through the laceration. It confirms a perforation.
So you actually see it?
You literally see clear fluids streaming through the dyed tear film, washing the dye away, turning it green. It's definitive.
Wow. That dye sounds incredibly powerful, almost magic.
Yeah.
What else do vets meticulously assess once they have that clear visual?
So beyond the dye tests, they carefully assess globe integrity, basically checking if the eye has kept its shape, if it hasn't ruptured. A ruptured globe often means, unfortunately, irreversible damage. They also evaluate the full extent of the laceration itself. Its precise length, its depth, is it partial or full thickness? And critically, if it involves the limbus, that junction zone.
Right, the cornea sclera border.
Exactly. Ruling out foreign bodies is also vital. Sometimes that might need advanced imaging, like a CT scan, if something's suspected to be embedded deep inside. And taking conjunctival swabs for culture and sensitivity testing is important too, especially if infection looks likely.
It's interesting to think about what else could be causing similar symptoms, though. If a horse has eye pain, it's not always a laceration, is it? How crucial is differentiating that quickly?
Oh, absolutely crucial. Ocular pain can also be present with things like corneal ulcers, which are different from lacerations, or uveitis, that's inflammation inside the eye.
Okay.
Or conjunctivitis, glaucoma, blepharitis, which is eyelid inflammation, even dacryocystitis, tear duct inflammation.
A whole list of possibilities.
Exactly, and that's why a comprehensive exam, relying on these specific tests like the fluorescein stain and Seidel's, is so essential for differential diagnosis. You have to rule out everything else to land on the correct diagnosis, which is critical for the right treatment. 3, the path to recovery. Treatment strategies.
So once it's diagnosed as a laceration, what's the game plan? Our sources suggest it can range from maybe just medical management to pretty intense surgery.
That's right. For superficial, non-perforating lacerations, medical therapy alone might be enough. Manage the pain, prevent infection, let it heal.
Okay.
However, for deep or irregular corneal lacerations, and certainly for all full-thickness perforations, surgical repair is almost always required. It's really the only way to try and save the eye and potentially vision.
What are the immediate steps a vet might take then, even before thinking about extensive surgery? What's the first aid protocol, essentially?
Good question. Immediate treatment typically involves tetanus prophylaxis standard for any traumatic wound in a horse. Then systemic anti-inflammatories, usually NSAIDs like bute or flunixin, for pain and swelling. And systemic antibiotics to prevent or treat infection getting into the bloodstream or deeper tissues.
Makes sense.
Topically applied antibiotics are also crucial right onto the eye surface to fight local bacteria. And atropine is often used if there's concurrent corneal ulceration or uveitis. It helps dilate the pupil, which manages pain and prevents complications like the iris sticking to the lens.
Okay.
But a key caution from our sources, topical steroids. Absolutely avoided until corneal integrity is confirmed. They can severely worsen infections or delay healing in a perforated eye.
That's a critical point. Okay, and this is where, as you say, it gets really complex, the surgical repair. The precision needed sounds incredible. What are the goals there, and what do these procedures actually involve?
Yeah, it's truly microsurgery. The primary goals are, first, to restore the integrity of the globe, stop leaks, prevent low intraocular pressure, prevent infection getting inside.
I'd seal it up.
Exactly. Second, restore normal anatomy as much as possible to preserve vision and function. And third, of course, prevent or eliminate infection.
How do they do that on something so delicate?
For corneal lacerations, it's almost always under general anesthesia. The anterior chamber might need to be carefully reformed with a sterile solution if it's collapsed. Then surgeons use incredibly fine, almost hair-thin absorbable sutures. Yeah,
Wow.
like 7-0 or 8-0 Vicryl. It requires microscopic precision to carefully bring the wound edges back together perfectly. Precise apposition minimizes scarring and astigmatism, which would blur vision later.
So it's not just closing the hole, it's closing it perfectly.
That's the goal. And for really aggressive ulcers or large defects, sometimes more advanced techniques are needed. Things like conjunctival pedicle grafts using the eye's own tissue.
Like a living bandage.
Kind of, yeah. Or amniotic membrane grafts. These provide tectonic support like a biological patch and bring in a vital blood supply to help healing. Scleral lacerations, too, need careful exploration and suturing, often near that limbus area, especially if caused by blunt trauma.
After such involved and precise procedures, I imagine postoperative care must be just as critical as the surgery itself. It's not over once the horse wakes up, right?
Oh, absolutely not. Post-operative care is intensive and critical to success. It includes aggressive topical and systemic antibiotic therapy to really hammer any potential infection.
Okay.
Continued systemic anti-inflammatory meds for pain and swelling. Atropine is usually continued for a while, too.
And protecting the eye.
Paramount. Elizabethan collars, or sometimes specialized hard or soft cup hoods, are essential to physically prevent the horse from rubbing or bumping the eye, which they'll definitely try to do.
I bet.
Stall rest is necessary, strictly limiting movement, and regular, frequent reevaluation by the vet team is crucial to monitor healing and catch any complications early.
So what happens in the worst-case scenario? If the injury is simply too severe to repair, or if complications just overwhelm the eye?
Unfortunately, yeah, that happens. If a traumatic corneal perforation just can't be repaired surgically, or if there's extensive extrusion of the intraocular contents like the iris, lens, vitreous.
Just too much damage.
Right. Or severe, uncontrolled bleeding inside the eye or overwhelming infection, then the eye may need to be enucleated.
Meaning removed.
Meaning surgically removed, yeah. It's obviously a last resort, but sometimes it's necessary to alleviate chronic pain and prevent more serious systemic complications. 4. Looking ahead, prognosis and complications.
This all raises a really important question. What's the expected course?
Sure.
What's the prognosis for a horse with these types of injuries? Does every horse fully recover, or are there often long-term challenges?
The prognosis varies hugely. It really depends heavily on the initial severity of that injury. Several factors play a big role.
Like what?
The length and depth of the laceration itself. Shorter, non-perforating ones generally have a significantly better outlook. The presence of iris prolapse or other intraocular tissue pushing out indicates much more severe damage and carries a poorer prognosis. Involvement of the ciliary body, that's a critical structure inside the eye responsible for fluid production and focus, that also worsens the outlook.
And timing matters, you said?
Critically, timeliness of treatment is huge. Prompt surgical intervention dramatically improves the chances of saving the eye and vision. Delay is really detrimental.
Right.
And then initial visual acuity, if it can be assessed, the amount of bleeding inside the eye, and any damage to the lens or the retina at the back of the eye, those are also major factors in predicting the final outcome.
So even with prompt, aggressive treatment, and maybe even a successful-looking surgery, are there still potential complications down the road?
Definitely. Complications are unfortunately quite common. Corneal scarring is a big one. Depending on where it is and how dense it is, it can permanently impair vision. Astigmatism, too, that irregular curvature of the healed cornea, can distort vision.
What else?
Infection is always a major risk, especially endophthalmitis. It's a severe infection inside the eye. It can be devastating, often leading to blindness or loss of the eye. Other possibilities include glaucoma, that's high pressure inside the eye,
Right.
cataracts, which is clouding of the lens, and retinal detachment. Lots of potential pitfalls.
The sources mention one complication that sounds particularly bad. Physis bulbi. What exactly is that, and why does it happen?
Yeah, physis bulbi. It refers to the irreversible shrinkage and essentially withering of the entire globe. The eye just sort of collapses in on itself.
Oh, wow.
It often leads to blindness and usually means enucleation is necessary eventually. Our sources highlight that failing to detect a scleral tear initially, or maybe inadequate repair, can lead to chronic hypotony that's persistently low pressure inside the eye, which is a major cause of the globe shrinking and atrophying like that.
So that missed scleral tear can have devastating long-term effects.
Absolutely. Severe intraocular hemorrhage that doesn't resolve can also lead to it. It's a really devastating outcome that underlines just how interconnected and fragile the eye structures are, especially after severe trauma. It really emphasizes why that initial meticulous assessment is so critical.
So after this incredibly detailed deep dive, what does this all mean for you, our listener? What's the ultimate takeaway message here?
I think it really means that equine corneal and scleral lacerations are true ophthalmic emergencies. They require immediate veterinary attention, and often that means referral to a specialist, a board-certified veterinary ophthalmologist.
Right, not something to wait on.
Definitely not. And while the prognosis can certainly be guarded, sometimes poor, depending on how bad that initial injury is, our sources strongly stress that prompt, aggressive medical and surgical management can often preserve the eye. And in many cases, it can preserve functional vision for these amazing animals. Outro.
What an incredibly detailed and frankly intricate deep dive into equine eye health. From understanding those really subtle early signs of injury to the complexity of microsurgical repair and that whole careful dance of postoperative care, it's crystal clear these are not simple injuries. It's a testament to remarkable veterinary skill.
Indeed. And the critical importance of swift action, getting that specialized veterinary care right away when you even suspect eye trauma in a horse, that really can't be overstated. That's probably the most vital message for you to carry forward.
So what does this all mean? I think the next time you look into a horse's eyes, maybe you'll appreciate not just their expressive beauty, but also their incredible fragility. And maybe you'll have a new appreciation for the dedication of veterinarians who, with immense precision and skill, can literally piece back together something as delicate as a damaged cornea, often fighting in some pretty steep odds. It's a remarkable testament, really, to how far veterinary medicine has come in preserving not just vision, but the quality of life for these magnificent animals.